Okay, let's dive right into this explainer. Today, we're going to demystify exactly how you can manage atopic dermatitis, step by step. Now, if you or a loved one are dealing with this chronic, relapsing condition, which we commonly call eczema, you already know how incredibly frustrating that constant itch and irritation can be. But stick with me, because today we're looking at the hard clinical evidence to give you a clear, structured roadmap to actually reclaim your skin's health.
We'll be walking through a clear action plan today. We're going to cover understanding the impact of atopic dermatitis, Step 1, which is consistent moisturizing, Step 2, covering topical corticosteroids, second-line treatments, and tracking. And we'll wrap up with pregnancy and breastfeeding safety. Let's get right to it.
Section 1. Understanding the impact of atopic dermatitis.
Before we can even think about treating the problem, we really need to understand what's happening to your skin at a microscopic level. Think of your skin like a leaky seal. In a patient with atopic dermatitis, certain genetic factors, specifically mutations in what's called the FLG gene, lead to a deficiency of a crucial protein called filaggrin. Now, why does that matter? Well, this protein is literally essential for your skin's natural moisturizing factor. So when it drops, your skin physically loses its ability to hold on to water. Because of this disrupted barrier, all sorts of environmental irritants, allergens, and infections can basically sneak right inside. And that triggers a massive inflammatory response, which leads to scratching and, well, even more tissue damage.
So how do health professionals actually assess this broken barrier in a clinic? They're looking for specific visible signs to validate exactly what you're seeing in the mirror at home. It almost always starts with an intense itch. And get this, that itch can happen even if a rash is invisible yet. Then they look for erythema or redness. Though actually, a quick side note here, in patients with skin of color, this might not look red at all. It often appears violaceous or hyperpigmented. They're also checking for scale, oozing, crusting, and finally, lichenification. That's a fancy medical word for that thickened, leathery skin that develops when you've been rubbing the area for a long time.
But we have to ask ourselves, beyond the physical rash, what is the real, day-to-day cost of letting this disease go untreated? It's honestly so much more than just a surface-level issue. When you don't treat this properly, you aren't just dealing with a rash. You're losing sleep, you're struggling to focus, and you're taking a massive hit to your overall well-being. The clinical guidelines highlight that poorly controlled eczema leads to major sleep disruption simply because you're up all night scratching. And that exhaustion, it bleeds into everything. It impacts your mood, your temperament, your self-esteem, and your ability to focus at work or at school. So getting this under control is quite literally about getting your life back.
Moving on to Step 1. Consistent moisturizing. The absolutely crucial point here is fixing that leaky seal we just talked about. And that brings us to your foundational daily defense. Your essential first step is this simple daily routine to manually seal in hydration and stop future flare-ups before they even start. Now, your bath shouldn't be a prolonged scalding hot soak. The evidence strongly points to keeping it brief, just 5 to 10 minutes in warm water. When you get out, whatever you do not rub your skin aggressively with a towel. Just gently pat it dry. Then, immediately slap on a liberal amount of moisturizer to lock in all that water. Using lubricating moisturizers frequently, like plain old petroleum jelly, is considered first-line therapy. You want to do this at least once a day, and make sure you're avoiding products with added fragrances or weird irritants.
Section 3. Step 2. Topical corticosteroids.
Of course, sometimes that daily moisture routine just isn't quite enough. When a flare-up breaks through your defenses, we move to the most effective first-line medication. Let's tackle something called steroid phobia right here, right now. A lot of people are terrified of using topical corticosteroids, which leads to massive undertreatment. But the clinical consensus is crystal clear. When prescribed and used correctly, they are incredibly safe. They work fast across multiple inflammatory pathways in the skin. Honestly, chronically undertreating your eczema, which leads to secondary infections and severe sleep loss, is way more damaging to your quality of life than the extremely rare adverse effects of proper corticosteroid use.
A huge reason people fear these treatments is simply because they don't know how much to use. To make sure you're using the correct amount, doctors recommend what's called the fingertip unit. This is just 0.5 grams squeezed from a standard tube right onto your fingertip from the tip down to that first crease. That single, tiny 0.5 gram unit is actually enough medication to safely cover an area the size of 2 adult handprints. By measuring it out this way, you make absolutely sure you're applying an effective dose without going overboard.
Section 4. Second-line treatments and tracking.
Now let's see how our plan adapts when standard first-line options aren't the perfect fit for your specific situation. Sometimes you just need a different approach, especially for super sensitive skin. We can contrast broad, fast-acting corticosteroids with second-line options called calcineurin inhibitors, things like tacrolimus or pimecrolimus. While steroids act like a broad net to rapidly calm inflammation down, calcineurin inhibitors are, well, more like a targeted dart. They specifically block calcineurin, meaning they do work a bit slower, but they are incredibly safe and totally ideal for delicate areas like the face or skin folds, where you really want to limit steroid use.
Regardless of which treatment you go with, you have to be the protagonist in tracking your own healing. On day 1, the second you identify a flare, which remember might just feel like an itch, start your prescribed treatment immediately. Throughout week 1, keep doing your treatment every single day. You literally must treat it until the itch and the physical rash are 100% gone. Do not stop just because it looks a little better. But if you hit that 14-day mark and your skin hasn't significantly improved, that is your hard trigger to request a professional medical reassessment. You might need a stronger medication, or there could even be a subtle secondary bacterial infection that needs to be addressed.
And finally, Section 5, Pregnancy and Breastfeeding Safety.
We definitely need to outline some highly specific safety parameters for expectant and nursing mothers. It's really interesting, actually. While some women see their eczema get better, over half will experience a worsening of their condition during pregnancy. To navigate this safely, you've got a few clear options. You can absolutely safely use liberal moisturizers and low to mid-potency topical steroids throughout your pregnancy and while breastfeeding. UVB light therapy is also considered safe. However, you've got to carefully manage how and where these are applied. If you develop eczema on the areola while breastfeeding, which by the way happens to up to 2% of nursing moms, you have to gently but thoroughly wipe the medication off before the baby nurses. For all topical meds, you want to completely avoid any direct contact between your infant and the skin you've just treated.
Now, here is the most critical safety warning in this entire explainer. It is absolutely crucial that pregnant or breastfeeding individuals completely avoid oral systemic medications, period. Drugs like methotrexate, mycophenolate mofetil, and oral JAK inhibitors are strictly contraindicated. These are powerful medications and they carry serious, well-documented risks to infant development. They must be stopped, often months before you even try to conceive. If your eczema is incredibly severe, you have to work very closely with both your dermatologist and your obstetrician to map out a treatment path that's actually safe for both of you.
We have covered a lot of ground today, from the genetics of a leaky skin barrier to the absolute necessity of that 5 to 10 minute bath routine and really conquering the fear of highly effective topical treatments. By following this structured step-by-step plan, tracking your progress closely, and knowing exactly when to escalate your care, you can finally take back your rest and your focus. Listen, your skin barrier might be compromised right now, but your quality of life absolutely does not have to be. So what step are you going to implement today to reclaim your comfort?